Welcome to the DIERS Academy and the expert interview with Professor Marcel Betsch. They introduced the head of the orthopedic department at the University Clinic in Erlangen.
Thank you very much for giving me the opportunity to talk about raster stereography today. There have been really a lot of studies over the past couple of years, not just years, actually now decades. So there have been studies that show that there's good validity between radiographic measurements and video raster stereographic measurements. Just showing that even under dynamic, really fast movements, but even with slow movements, that the system is really capable of detecting these landmarks. The first motion lab was established, show no significant difference in terms to the gold standard bicom measurements. To work also in a multi-center study with really renowned scoliosis and spine surgeons from the US, more than 190 patients where we correlated raster stereographic measurements of the spine with radiographic measurements. And here we could show high correlation coefficients of 0.75 for the kyphosis angle and really good correlation, and also for the lumbar lododic angle of 0.71 with good correlation. Every system is also based on a different technology that's behind it. It's just simple X-rays. We are, of course, able to really look inside the bodies. But on the other hand, there's still the issue that this can be harmful for our patients, in particular in young patients. When we look at MRI, the patient has to lay flat. So it doesn't really give us an information how actually the spine and also the posture looks like. We're now with the motion lab able to measure from the foot all the way up to the lower extremity, to the pelvis, to the spine, which is something that classical methods like MRI or X-ray are not capable these days. This is really significantly different from traditional methods, something that significantly helps us understanding where the pathology is coming from, where it originates, and also what the effect is in other joints. I think it's just clear that there's significant difference in terms of the technology that's behind the two measurements and the philosophy. Video raster stereography mainly is a system which allows us measurement quantitatively of the back surface itself. Based on these anatomical landmarks and a biomechanical model, we're then able to model the underlying bony structures. So this is something that is significantly different. It was never intended to measure exactly the same.
For example, taking in a scoliosis patient, you would need that first X-ray image of the spine and the scoliotic deformity that you see there and correlate this also to morphologic discrepancies. From there on, you can then compare it also to a radiation-free spinometry, and then you can move on from there by setting that intra-individual correlation between the X-ray and the spinometry measurement, going on with further postural progression control. And this then gives us the opportunity to reduce the X-ray, isn't it?
Yeah, absolutely. I mean, that's the whole idea behind the system, how it was initially developed. It was really to save some ionizing radiation, in particular in our young patients that need routine follow-up. And I think this is really something where the system can help us significantly. As you mentioned, I think there's no question that for certain diagnosis and certain purposes, we always will rely on radiation systems like X-ray or sometimes MRIs. But as you mentioned before, I think really spinometry can be a very helpful and really valuable additional tool, where in particular when we follow up closely our patients, where we have something where we can quantify our changes that we see in terms of therapy. And we can do that more frequently, that we will be able to do that with any kind of imaging system like MRI or X-ray. Imaging modality, it is dependent on the patient itself, more or less the body weight of the patient, but also musculature. So because our correlation between the surface itself and the underlying bony structures is not that high anymore. You need to make sure that you position the patient correctly. You need to make sure that the system is actually able to visualize and detect these anatomical landmarks. Same goes with any kind of traditional classic radiological measurements. For me, it was always important to also use that method and that technology really in the clinical setting. It really gives us the opportunity to use the system and also to gain information about the posture, about the gait of patients that we were not able before. We've looked at pregnant women, and really we were the first study to really look at differences in terms of posture and spinal alignment during pregnancy and also afterwards. And now with the new technology where we have the high performance motion lab, now we can really use it for athletes, and we can really track them and get some information in a completely different way that we were not able before, just because we have now the technology behind the system that we can really do some running analysis that we haven't had before. Our whole musculoskeletal system is not a static system. Just when we look at the spine itself, I mean, there's so much muscle work, so much work of the tendons and the ligaments that just keep us upright. So just having a snapshot, I don't think gives us really the full picture. And then of course now with the opportunity also looking at leg axis measurements and also pedoscan measurements, so we can really look at the whole kinematic chain of our musculoskeletal apparatus. What are the influences between the knee and the hip and the spine itself? We can really look at certain segments of the spine, how they affect each other. And I think this really will help us in the future to treat certain pathologies. Well, I think as we talked about before, there's a lot of technology, a lot of development over the last couple of years. And of course, certain things also when it comes to MRI or even just X-rays, where we've seen some technological advancement over the last couple of years. As you mentioned, there's some functional MRI imaging now possibilities that we have. We've got some centers now have the opportunity to have like an upright MRI imaging device, so we can really now measure the spine. Now we also have the opportunity to do that in an upright position where the actual spine and the segments and the discs are actually loaded. So this, of course, will give us some information. As I mentioned before, I don't see that there's any competition between these, when I can call them like classical radiographic modalities and spinometry. I think this is just really something that has like an extra value. I think we just have to keep in mind also the duration of the availability of the system itself. I mean, when we go back and looking at the static system and the classical system out of the University of Münster, I mean, this system is more or less around since the 1980s. So it's been around more than 40 years. So for how long we really have now the 4D motion lab, I mean, this is also less than 10 years. So there's just a lot of more data just because it was more available, it was longer on the market. So I think this is one of the aspects why we still have so many more static studies, just because it's been around more often. And then also when we look at the market itself, there's still way more static systems around worldwide, in particular also here in Germany. So not everybody yet has a 4D motion lab. There's definitely a change coming over the next couple of years where a lot of users will switch. And I think we're up for a treat. So we will see a lot of good studies, some new technology that will help us with the data set that will make it a little bit easier for the individual user to use the system.
We need the scientific work to further go more into that clinical relevance of dynamic spinometry, as well as also for static postural screening.
Technologies can sometimes be faster than actually sciences. And I think just as academic centers, our job is really to catch up and really, use the system, validate the system, that we can really give some information back to the user, how to use it, what to use it for. And I think we're going in the right direction. And I really like it that technology advances so fast. So it's really fun to catch up over the next couple of years. Yeah, Mr. Soba, thank you very much for the opportunity. Really happy. I think we had a really lively discussion about the spinometry, and I'm more than happy to share any thoughts in the future as well. If there's any users out there that'd like to collaborate or have any questions, feel free to contact me. I'm more than happy to collaborate. And thank you.